Hi everyone, and welcome to tonight's webinar. My name is Jasmina Alagic, and I'm an accounts manager here at Erchonia Lasers EMEA. It's an absolute pleasure to kickstart 2025 with all of you by presenting this exciting session, Unlocking Wellness, Erchonia non-thermal lasers for fat loss, mitochondrial efficiency, and accelerated healing. We are honored to be joined tonight by the incredible Dr. Dev Patel. Dr. Dev is the founder of the disruptive skincare brand CellDerma and the award-winning aesthetic clinic Perfect Skin Solutions. As an experienced Erchonia and Emerald laser user, Dr. Patel brings a wealth of knowledge and practical expertise to the table. Tonight's webinar will explore the transformative applications of non-thermal lasers in health and wellness, from enhancing mitochondrial efficiency and promoting healing to revolutionizing fat loss and body sculpting. This session promises to be both insightful and inspiring. We will be happy to assist you further at the end of the webinar, which for your reference will be recorded and sent out to all the attendees. I would like to alert you to the question and answer box on the right-hand side of your screens, which you can use to type the questions to Dr. Dev. We will be addressing these questions at the end of the webinar, but please type them in as we go along. So, without further ado, over to you, Dr. Dev.
Okay, amazing. So I'm just going to share my screen. Share screen. You can see that, right?
Yeah, perfect.
Okay, brilliant. So welcome everyone. By the way, I'm used to delivering webinars, but it's always very strange when you cannot see anyone, and I'm literally just looking at a small pinhole. But welcome and thanks for joining. Most of you will have been at work today and probably a bit tired, and maybe don't want to listen to me drolling on about low-level laser. Thanks for the very gracious welcome, Jasmina. Yes, I speak on low-level laser and I know a fair bit about it. I generally wouldn't call myself an expert, just because every time I read a journal or a paper or something about this, I feel I have to look up another 100 things to understand those things, and it's never ending. It's a minefield, and I think of all the technologies that I've ever introduced into my clinic, and many of you will know I am known, I've got a bit of a problem with technology and seem to buy anything that I feel will be good. This area and arena is so deep, there's so much, and there's so much research that has gone on over actually not just 10, 20, 30 years, but actually far more than that. And I'm only touching the surface. So I was asked to deliver a talk, which I actually delivered to a group of doctors last year. And I appreciate I'm going to have a mixed audience, and there may be some members of the public as well who are joining. So forgive me for using certain scientific language or medical language and not putting it into context or explaining it. I don't normally like doing that, but genuinely some of the slides would need a couple of hours just to fully explain everything on them. So I'm going to skip through a number of stuff, but I hope from today you get a little bit more insight and flavor into the incredible wonder of low-level laser technology. So we're going to talk about, I will talk about Emerald, which is green low-level laser. Who makes this? Erchonia makes this. Jasmina works for Erchonia, and Erchonia are an American company, and they own over 22 patents of, I think probably not many more, 25, 26 patents on low-level laser technology. So they are really the masters of it in terms of research and development for this technology. And many people will put under this low-level light, so some people call it low-level light therapy, and then that would include LED. But we're very much talking about laser today, which is slightly different, and I'm going to focus on that. So many of you will know me, hopefully, but I'm here in Portsmouth, south coast of England, and as Jasmina said, I'm in Perfect Skin Solutions right now. if you can see behind me, and also CellDerma is born of a passion, so thank you for mentioning that. You may have heard of GF5, our great growth factor serum, but that is really the culmination of years of interest in regenerative medicine, and actually this goes into regenerative medicine, but far beyond what I'm talking to you about today. So why are you here? Well, you're here probably because you're interested. You might have heard mitochondrial function and thought, oh, I've heard about mitochondria. And actually, I'm hearing so much about stuff that's connected in some way to mitochondria. People talking about NAD. I've had 3 people message me this week about NAD, supplements and injections and IV. Well, where is NAD involved? It's in the mitochondria. So whether you know it or not, there's probably something that you've thought about or are interested in that's connected with something that we're going to talk about today. But it's, for practitioners, about elevating your practice. It's about being able to deliver something better and beyond the norm. Now, a lot of people, when they see low-level laser in action, they see this light, they can't feel it. If you put the safety goggles on, you can't even see it. And so actually, when there's no downtime, no pain, no symptoms, a lot of people will say, does it do anything? Does it do anything? And actually, I want you to think of a plant, because when light hits a plant, it ultimately triggers a cascade that gives it life. Plants cannot survive without light. And as you know, light hits a chromophore, a target, which is chlorophyll in the case of plants. And that triggers this process called photosynthesis, and essentially allows the plant to produce energy and survive. Now, we take that for granted. And those of you who like plants will say, well, I need to put this plant in the sunlight. And yet, when we're doing the same thing with light and a human being, suddenly even medics, in fact, they're some of the most skeptical, will say, oh, really? Does it do anything? Well, come on. We take a lot of things for granted that actually would sound much more far-fetched if you hadn't ever encountered them before. And what about taking a pill? I mean, we take it for granted. We pop something in our mouth, swallow it, and it goes into our stomach. And then within minutes to an hour, it's having all sorts of effects on various receptors and cells in your entire body. How far-fetched would that sound to someone who hadn't heard about a pill? So really, this isn't all that crazy. And actually, when I just want to dock control panel to screen. Hopefully that is, oh gosh, okay. Let me just move that to the side. Sorry, just wanna, Jasmina, can you see the screen, or are all these screens blocking it? I just want to be sure.
Well, it's a blank screen only.
Okay, but you're not seeing my face and all the other screens on top, the GoToWebinar and everything, are you?
No, no.
No, okay, right, okay. Sorry guys about that, I just wanted to be sure. Okay, so let's just go back to that. So yeah, you know, people's mindset and behavior is changing. You know, instead of saying wrinkles, we're thinking of elasticity. Instead of fat loss, we're thinking of lean fat. Instead of thinking just anti-aging, we're thinking regenerative and regenerative aesthetics. And instead of just talking about lifespan, which is how long are we going to live for, we're actually thinking about health span. How long are we going to live a healthy life for? So for how long are we going to be healthy? Because actually, as most of us will say, we don't want to just live till 110 if we're going to be, you know, very incapable of fulfilling day-to-day functions. So what is photochemistry? And Jasmina, you can see photochemistry and everything. Yeah, just let me know if not, because on my screen I've got lots of windows up. So photochemistry is really something that has been researched quite a lot. Boston University did some research on this as well. When we say photochemistry, we're talking about this low-level laser, this light, creating change through energy transfer, electron transfer within. So this is at a subatomic level. And this then ultimately results in a rearrangement of bonds within a molecule, resulting in a cascade of different processes to happen. And when we look at the spectrum of light, many of you practitioners, if you've often seen the spectrum of light, it's normally showing the other way around, so just bear that in mind. So as we go from left to right, the wavelength, the nanometers is going down, okay? And we're really talking about this visible light spectrum. But really, what do we measure it in? You know, when you're measuring your mass, it's in kilograms, you know, your height in centimeters. This is photon energy, light energy is measured in electron volts. And the shorter the wavelength, the higher the electron volt. And why is this important? Because we're talking with low-level laser about energy, not power. So if you see there, a 405 nanometer wavelength will have 70% more energy than an 830 wavelength. And the key thing is here is that to enable this photochemistry to happen, okay, this rearrangement of the bonds, you need a wavelength between 380 and 683 to have that, because that has got the ideal electron volt that you need. And so when we look at this diagram, you can see that actually as you go beyond 729, so more than 729, a greater wavelength than 729, you're not going to have sufficient electron voltage, i.e. a minimum of 1.7, to actually create that photochemical change that you want. It doesn't mean it can't have a benefit, okay, but then that's another method and another process, photobiomodulation. And so when it comes to low-level laser, think energy, not power. And in fact, studies have shown that less power is actually more effective. And you can see on the screen, there's various papers if you want to scroll on, and there's plenty more. This is a snapshot of the research that has been done on low-level laser. And in fact, it's been shown that you only actually need one photon to hit a target enzyme to actually start triggering a cascade of activity in the cells in the body. And so actually some of the early studies with low-level lasers, and I've got one here, were actually, you know, treating subjects for 20 minutes, maybe longer. And then over the years, the studies have actually had them just being treated for 3 minutes, 5 minutes, and still shown clinical efficacy. Now let's go to mitochondria. Mitochondria are, let me just keep an idea on time. So mitochondria are organelles, they're within your cells, and they are like your lungs to your body. You know, that's where cellular respiration is happening. That's where energy production is happening. But that's not a great analogy because it goes far beyond than just your lungs to your body. Mitochondria produce energy, ATP. They regulate your metabolism. They are key factor in apoptosis. Apoptosis is programmed cell death, which is important because every day you are getting mutations within your cells, you're getting damaged cells, disease cells, and your body has a process of troubleshooting all of this and killing these cells off and getting rid of them before trouble can happen. So for example, let's take cancer. That's when your apoptotic mechanisms don't work, and then you get this out of control growth, thus a cancer. So mitochondria are also involved in that, and calcium storage, and they help regulate intracellular calcium levels. And this is, calcium is really important, you know, for muscle contraction and even more so for signal transmission. And so actually, when we look at the link between mitochondria and certain brain conditions, these sorts of functions are very relevant when we look at that. And I'm going to touch on organs like the brain in a minute. Now, mitochondria have been linked to all key processes, but when you think mitochondria and you think aging and mitochondrial function going down, think inflammation as well. And of course, we're hearing more and more about inflammation. I'm talking about inflammation to every patient that I see, no matter what I see them for. I'm talking about inflammation. And actually, with decreasing mitochondrial function, we know that inflammation increases in the body, and there is a link. And there's also a link between declining mitochondrial function, inflammation, and also various disorders and age-related diseases. And when you look at various inflammatory markers. If you look at IL-6, for example, this has been shown in studies to be a very good predictive marker for aging, for specifically things like disability, fragility, walking speed, overall mortality risk. Now let's look at the brain. You know, these statistics are troubling. You know, 55 million people with dementia, and by 2030 expected to go up to 78 million. You know, depression is the leading cause of mental disability worldwide. Looking at developmental disabilities like autism, going up significantly in just that 10-year period. So really, this is a silent pandemic. And I know, of course, we hear more and more about it, and it's really good that mental health awareness is becoming more prominent. But it really is a silent pandemic, and it's alarming how the rates are increasing so much. And, you know, there's a whole bunch of possible causes being linked to it. And I certainly think how our diets are changing and what we're putting in our guts is certainly one of those. And I'm more and more trying to think of, you know, what am I eating that's pro-inflammatory and what am I eating that can be anti-inflammatory? And there's a link, surprise, surprise, between mental health and inflammation. And again, lots of research and studies on this. And I'm going to skip through some of this, but, you know, again, if you're depressed, if you're feeling low, you're probably inflamed. And again, lots of good science to back this up. So let's have a look at low-level non-thermal laser. Specifically focusing in on emerald. Emerald, which I've got in the clinic here, is 532 nanometers green laser light. And this is believed to have primarily target, I say believed to because I'm going to show you the study in a minute that shows something a little different, but targets, just like light for plants is targeting chlorophyll, this is targeting something in the mitochondria called cytochrome C oxidase. It actually targets a couple of things. And what happens here is quite amazing. Whatever it's targeting, essentially, we're getting an increase in ATP production, more energy. Now, when your mitochondria produce more energy, that is not only going to benefit the overall function of that cell, but the mitochondria itself will be working better. And we've already said how mitochondrial function declining has an impact on the entire body. It also reduces oxidative stress when this happens. Why? Because we're decreasing reactive oxygen species, we're increasing nitric oxide production, which helps with blood supply, and we're reducing inflammation, because when you improve mitochondrial function, you reduce inflammation, as we've already said, and because of its effect on ROS. But of course, there's also an impact on fat, which we're going to come to in a minute. So actually, when you look at the electron transport chain, this is the process by which we end up making energy. This is happening in the inner membrane of the mitochondria, and these four complexes are crucial. And what we can see here is that ultimately these electrons, remember we mentioned about electron transfer and energy transfer, these electrons are passed along. It's a bit like pass the parcel between the complexes, and eventually we get this reduction of this reduction reaction, which produces water and ATP, and ATP is that energy. So if we can speed this up, improve this, make it more efficient, give it a good whack, then actually what we're going to do is get more ATP and a more efficiently functioning mitochondria, and that's what we're doing with low-level laser. And so if we look here, we can see that violet and blue light, and so this one here has violet and red. So violet light, which is 405 nanometers, remember that's got the most electron voltage. That's preferentially getting complexes 1 and 2. Green light actually complex 3, and there is a study, at least one that I've seen, where actually it's believed that it's probably preferentially hitting that more. And then red light on complex 4, but also green light. So in an ideal world, you'd use all 3 wavelengths. But I've got a fractured foot at the moment, and I have been using this on my foot religiously to speed up the healing. But I'm, after this webinar, going to get on the emerald, stick the emerald over my foot, and get at least 10-15 minutes on this, because it's also been shown to help with bone remodeling. And actually, when we look at these complexes, this is interesting. Complex 1 and 3 have actually been shown to be highly susceptible to loss of activity and impairment due to aging, chronic conditions, but get this, drugs, medication. I'm not saying to people just stop your medication, absolutely not. But it just goes to show that people, particularly on long-term medication, the potential negative impacts it can also have. And I certainly came across patients in general practice where sometimes we just stopped medication and they just felt better. And please, 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 big disclaimer, I'm not telling people to just stop their medication. Always speak to your prescribing doctor or prescriber, whoever that is, and get their advice. But what I'm saying is actually sometimes we do need to think about the flip side of things. And really, you know, when we're talking about cytochrome C oxidase and reductase and other things, we're really going at a very superficial level. You go into it in detail, it's a massive subject. It's a massive subject. You can even see copper mentioned there, which is actually one of the reasons why I've put copper in here. But that's another subject. Let's look at pain. And actually, most of the indications, the clinical indications for this device, EVRL, are actually for pain because the studies have been done on pain. And chronic pain, which means long-term pain, affects at least 10% of the global population. And at any one time, you know, more often than not, people have got some form of pain somewhere. But long-term chronic pain can really be debilitating, and you know, has a massive impact on the output that we all have. And so actually, if we can manage this without drugs, without the cost of drugs, even better, without the potential side effects. And how does low-level laser actually help? Well, this is too much. This is a webinar in itself, but it reduces inflammation. We've already said that. If you reduce inflammation, then you're going to actually help with reducing pain. It improves circulation, partly through the nitric oxide production. And obviously, if you improve circulation, you improve healing and bring anti-inflammatory cells and immune cells to help with that. But also has a direct effect on nerve function. So you get, what else? You get endorphin release. So if you look here, this is showing various studies that have been done, and a couple of them on opioids. And so there's a couple of things there. Endorphins are your natural happy chemicals, if you like. And, you know, when you exercise, you produce endorphins, you feel better, you feel happier. And actually endorphins help with making you feel better and pain as well. So they help encourage endorphin release, but also have been shown to help modulate opioid receptors, particularly mu opioid receptors. They reduce ROS, reactive oxygen species, which again indirectly helps with pain management, and also through photobiomodulation, which is another mechanism by which light can instigate cellular activity. It's actually been shown that a low-level laser can reduce the excitability of peripheral nerves, and also centrally, so at the spinal cord and brain level, can also dampen down pain sensation through fibers such as C fibers, etc. So there are lots of different mechanisms by which low-level laser can help with pain. I already realize I'm talking far too much, so I'm gonna speed things up. And look, this is why I'm going to stick the green laser on me, because hey, it's actually been shown to help with nerve regeneration, but also bone remodeling, and I need that because I need my fracture healed very quickly. This is exciting, the brain-gut connection. This is amazing, and I wish I could talk for a few hours on this, but let me just show you this. When you have a traumatic brain injury, okay, so something severe, a car crash, and you get a traumatic brain injury, the gut within 6 hours is leaky. Look at the difference. You don't need to understand histology, but look at the pattern of the gut lining in a non-injured rat and an injured rat. Look at the difference. And you get this leaky gut. And what does that do? A whole bunch of inflammatory cells turn up and create this toxic effect. And in fact, you can even get something called septic shock. You may have heard of that. There's been a lot of publicity around it. You can get septic shock from a traumatic brain injury. Go figure. Well, it's because of this mechanism. So park that thought for a minute. Park that thought for a minute. Let's talk about neurodegeneration, wear and tear of the brain. Again, things like, you know, dementia and all these neurodegenerative conditions, these have all been linked. These have all been had some research involved with low-level laser, and there is some emerging evidence of real benefits of low-level laser in reducing the risk of dementia. So here's the thing, the brain-gut axis. If we can reduce inflammation, then we can help with the brain and vice versa. Now, the vagal nerve, you may have heard of the vagus nerve, and the vagus nerve is forms part of your parasympathetic nervous system. And think of it like the calming center. It's receiving sensory information from the organs such as the lungs and the gut and the heart, and it's also helping calm those organs down, if you like. So when we do vagal nerve stimulation, VNS, we can actually have a profoundly beneficial effect on those organs and therefore the whole body. It can calm us. And so if we can actually stimulate the vagus nerve, we can do wonders on other organs like the gut, like other components of the brain, the heart, the lungs, etc. And that's what's been shown. And studies have been done whereby you can use low-level laser to stimulate the vagus nerve and actually prevent these issues happening. And in this study, they did just that. They did vagal nerve stimulation. And with traumatic brain injury, you can see that the gut architecture is relatively maintained to normal gut architecture, which is far left. But in the middle, where you only have traumatic brain injury without the low-level laser, without the vagus nerve stimulation, you get that disordered gut lining architecture and leaky gut, etc., etc. And they were actually able to show prevention of septic shock happening by applying low-level laser to animals with traumatic brain injury. I'll leave it there because actually I won't get to some of the other stuff. I just want to say you don't need a low-level laser device purely for vagal nerve stimulation, and you may know that there's various yoga breathing, other breath exercises, even humming, singing. Why do we feel so relaxed? You know, when we sing, well, maybe not when we're listening to someone singing, but certainly ourselves. So there's various methods that you can use. And my good friend, Dr. Patel, who is a doctor and an NLP practitioner, he actually taught me some breath work last week to help stimulate the vagus nerve. But this is just one of many things that the low-level laser can, of course, do. Let's look at obesity. We all know this is another pandemic. This is another pandemic. And again, it is only getting worse. The figures are startling. Every decade, they just get worse and worse. And of course, obesity is linked to everything. Everything from heart disease to cancer, you name it. And it really is, I think, something that needs a serious, even more serious looking at than you know, governments and health bodies are at the moment. So when we talk about fat, we often think of it in a negative way, but fat and fat cells form a crucial part of the endocrine, the hormonal system in your body. So what we want really is we want healthy or lean fat cells. We don't want unhealthy fat cells because they secrete these chemical messages which actually are a bad influence on other healthy cells, and you get this kind of toxic cascade. They're troublemakers. Whereas when you have a lean fat cell, they're a good influence, okay? They're a good influence on the other cells. They release healthy messages to other cells, so they're crucial. So we actually want the fat. Now, when we look at various non-invasive fat reduction technologies out there, we find that actually when you look at the science, when you look at the evidence that's been submitted to the FDA in America by these companies, you can actually see that the changes, the improvements with these other technologies are pretty negligible compared to when you're using low-level laser, green 532 nanometer laser through photochemistry, and actually you can get quite profound reduction in circumferential measurements. In fact, most of the other technologies, I'm going to show you this. If you look here, and if you look at the various technologies, you can see that over a 12-week period, we're talking most technologies did that. but look at Emerald 532 laser, okay, over 4 or 6 weeks it was, and I think that would have been 8 sessions or 10 sessions, and look at the loss, 15.4 centimeters. That is, just to put it into context and transparency, over 3 measurements added together, but that's still very impressive. So like 5.45. So let's have a look at fat cells. Here you go. This is a very complex diagram, but it's essentially saying those unhealthy fat cells are releasing pro-inflammatory signals. We don't want that. We want lean fat cells that are releasing anti-inflammatory signals. So by having healthy fat, it's not just a cosmetic thing. It's not, you know, it's so much more than that. We are essentially in a more of a pro-inflammatory state if we're obese. And that pro-inflammatory state, we've already said there is a direct link between inflammation, chronic inflammation, and pretty much every health condition there is. It's all linked. Now, Emerald, the beauty is no pain, no downtime, no side effects. I would pretty much say no risk. Anyone can get under it pretty much. There's probably a couple of contraindications, which frankly, you know, we don't really need to go into now, because pretty much everyone can get under it. And the beauty of this is that unlike our other devices in clinic, which are good, this is actually FDA approved for people with a BMI up to 40 rather than typically 30, which means when you are in that obese spectrum and you really are in a psychological rut and you just don't feel like doing anything and you just carry on eating and it is a little bit of a spiral, this can be just the thing to actually get you going. It'll give you more energy, people feel more energized, but actually can give some real genuine circumferential loss and give you that little spark up here to say, hey, I can do this, I can do this. Whereas with other technology, really, if someone isn't leading a healthy lifestyle and in a fairly healthy way, and it's not just for pockets of fat, we would probably be declining and saying to them, hey, look, you know, this isn't for you, we really want you to go down another route. Of course, healthy lifestyle, nutrition and exercise are so important, and we of course give a holistic treatment plan to our patients. But this technology is quite amazing in what it does and does stand aside from the other non-invasive methods.
I've just got one question dropped from one of the attendees, if you wouldn't mind, Dr. Deff. Can you hear me?
Talking to me?
Yes. I've got a question from one of the attendees. So would you mind answering the question if I dropped it over?
Yeah, can we do that at the end?
Of course, no problem.
Yeah, because it would just ruin I've cut the video now. Yeah, let's do questions at the end, because otherwise it just ruins the flow, if that's okay.
No problem.
So what that video was going to show is essentially the beauty of this is you can treat multiple areas. So you can actually safely do the chest, you can do the moves, as we say, for men. You can do the abdomen, you can do the back fat, the side fat, the bra folds, the arms, the thighs, the buttocks. And the other nice thing is that in a 30-minute session, you can actually do the entire circumference. So on someone of my size, you could comfortably do from moves down to the pelvis. Women perhaps who have less, certainly they're not really going to want to do anything here maybe, but they maybe want to get a little bit on the abdomen, certainly the buttocks, thighs. You can actually do that whole area in one session, 15 minutes on top, flip over 15 minutes, because it's actually got enough enough light to actually cover that whole area, which again is unusual, where most equipment that we have in the industry, you have to be very selective on the areas that you're going to be able to treat in any one session. In terms of research, there is grade A evidence on this. Multi-center, double-blind, randomized control studies. This is the sort of evidence that a pharmaceutical drug needs to get. are privileged to be able to use technology that has got this level of evidence. So there is no doubt this stuff does what it's meant to do. I'm just going to skip this, otherwise I'll never be here. I'm going to skip this, but again, it's a little bit more on the background and the history behind how this came about. And this doctor was actually using this technology pre and post liposuction. So what happens with the fat cells? Well, here it's interesting. It's been shown, you can see this microscopically, that ultimately the cellular reaction that's happening is leading to this temporary pore being created in the fat cell in the adipocyte. And then what happens is the triglycerides are broken down to free fatty acids and glycerol, and these exit the cell through this little pore, and then your lymphatic system will eradicate it and take it away. And there's studies that have even shown, which we'll probably come to, that actually it doesn't go and just lay down somewhere else. But also what it's going to do, because it's improving mitochondrial efficiency and function, is it's going to increase your metabolic rate, which in turn will also mean that even between sessions, you're likely to be burning more calories. Other benefits are that because of the cellular benefits, you're going to make more collagen, and sometimes patients do notice and they say, actually, my skin quality looks better. Your repair and regeneration is going to be better. Your blood flow is going to be better. So all in all, really good adjunctive health benefits. This is just a bit more of the kind of research in the background. It's a temporary pore, remember. So after 15 minutes, we flip you over, and that's enough time to basically do what it needs to do and create this lean fat cell from an unhealthy fat cell. And interestingly, as that happens, these signals are passed to adjacent cells, and they start doing similar things. This is just some of the evidence. Again, I could go on and on showing you the evidence, but I'm going to skip through this and just get to some photos. How do we know it's not dispersed to somewhere else in the body? Well, they've done, guess what? They've done studies on this as well. So we'll just skip through this video. I've just explained that. So after treatment, we do say exercise to encourage lymphatic drainage. We put every patient in a bodysuit, a lymphatic bodysuit, which we've seen has massively improved the results we're achieving. And these are just some of the other benefits that you're going to be getting. This is whole body benefits. Again, a whole list of the potential benefits of low-level laser. We could go on. I truly believe, I've said this in almost every talk, look at the difference between my phone and this. I truly believe one day, I hope, that everyone's phone will have this technology in it. And I think overnight we could reduce the health burden of the world by 50%, probably more. Again, I'll skip through all this because I've been through it. Here, I just want to show you some photographs quickly of some results. You can see, look, even the skin quality is better there. Even the cellulite is better there. This is one of our patients, and this was actually without, I think, maybe even without the bodysuit, if I remember right. With the bodysuit, we're definitely seeing better results because we're getting rid of that fat much more efficiently. Again, in men, you know, sometimes men are quite a little bit more difficult. They have a little bit more fibrotic fat, and with some of the technology, that we see less success. But actually, you know, with the Emerald, we're seeing some really good results even on men. This area can be treated. We have to switch some of the diodes off, so we're just focusing on this. We don't really want to affect the fat higher up in the face. Bra fold fat, again, you can see this with real measurements, and just some really nice feedback. And you know, it's true what they say. Sometimes the pictures don't quite show or reflect the actual massive loss that's been achieved. And I always say to patients, forget the measurements. Your clothes will tell you. Your clothes will tell you if this is working. And I would say about 80% of patients within 1 to 2 sessions have seen a nice improvement already. But Typically, we do a course of 10 in clinic with the body suit, 2 sessions a week. And of course, just quickly on skin health and showing some of the benefits of low-level laser light technology on skin, including wound healing. Because remember, if we are working at the level of the mitochondria, and of course, there are lots of other sort of cells that low-level laser is working on, we're getting a holistic benefit in the body. We're getting a holistic benefit. If you work on inflammation, it's going to help everything. Scars, that looks like probably, well, looks like a bit of an impetigo, but again, a chronic wound. And so just to summarize and bring it to an end before we do questions, what I've hopefully demonstrated to you is that low-level laser is different to thermal laser. It's different to what you're used to having, laser resurfacing, laser hair removal. That creates heat. You might have some pain. That's all about the power and et cetera, et cetera. This is different. This is about creating a photochemical reaction, a bit like sunlight and a plant, and working predominantly on areas like the mitochondria. These are little organelles within the cells that increases cellular efficiency, energy production, anti-inflammatory markers, and therefore has a holistic whole body cascade on the body, improving overall organ health and therefore whole body health. And ultimately, this is about health span, not just longevity, but living a healthier life for longer, and looking at the research base that we already have over many decades and the emerging evidence on some of the later studies. This truly, for me, is the most incredible invention, I think, that's been created when it comes to human health. So thank you for that. If you want to reach out to me, Dr. Dev Patel 1 on Instagram is a way of communicating with me directly. But of course, you can use those emails and try and follow us on all those accounts if you can. So thank you. So Jasmina, over to you. And sorry for pausing that question, but I know how my brain works, and I would have lost the flow. So we can stop sharing.
That's okay. Yeah, we've got one.
You WhatsApp the question to me, or
only one question from Peter Harding, saying, for a patient with chronic pain syndrome, would you recommend applying vagus nerve therapy? If so, could you expand on the settings and application?
Okay, I would. So the vagus nerve, it depends. We'd probably have to sideline this question, and if we can take her details, because it would depend. Is she talking about settings on this, or? Because if it's on this, I think it's easy. I think it's just 10 10 10 10 on the 4 numbers that you need to put in the vagus nerve. But because I've got it set to that, and I do that every day. But would stimulating the vagus nerve help with pain management? I would say yes, because actually, if you look at number one, if you've got pain, I would want to be doing the low-level laser directly on the site of pain, obviously. So if it's neck pain, do it on the neck area, etc. But because the vagus nerve has so many whole body benefits, including anti-inflammatory, and of course, inflammation is a key component of pretty much everything, including sites of pain. It goes without saying that by working on the vagus nerve, you are almost certainly going to help manage your chronic pain. Not to mention the fact that obviously vagus nerve stimulation puts your mind in a much better place, in a calmer state. And we also know that your pain threshold changes depending on how stressed you are. So when you can stimulate the vagus nerve, you will go into slightly calmer, better state, and therefore your perception of pain should be less. So the bottom line is yes, 100%. If it's on the EVRL, it's all 10s, I believe, but we can check and get back to you on that. I'm pretty sure it is. I like to do a little bit on the vagus nerve, and then I also do a little bit on the gut as well, working on those 2 key centers to actually try and help a little bit my holistic health as well. 3 minutes each.
Okay, thank you. I've got another question and saying, is there any experience on hair regrowth?
So I'll claim ignorance for that and say I don't know, but we'll find out. And if we can take the details, and Jasmina will message you back and let you know. But again, if we go back to the principles, I wouldn't be surprised if there's not a study on it. But if we go back to the core principles of low-level laser, I can't see why not, because it has regenerative benefits. I already mentioned that it due to when you're using it in the skin, we see that there's an upregulation of fibroblasts and therefore more collagen laid down. But it's not just the fibroblasts, it's going to be every cell. Every cell is going to respond by working in a more youthful manner, more efficiently and better output. So it goes without saying that if we could do something here, it is going to benefit. Of course, if we look in the wider sense, red laser and even red LED actually has been researched for hair, and many people will know. Even I got a hat many years ago, a red light hat, and I was using that for a while, but I'm really poor at using some of these things. So of course there is. I thought the question was specific relating to sort of this device or the Emerald, but if it is just in terms of low-level laser, then absolutely red light has been shown to help with hair regrowth and also increasing the health of the follicles. Therefore, the thinning hair that people have starts becoming thicker, follicular health becomes better, and therefore the roots are stronger, and some regrowth, absolutely. And I know a number of hair transplant surgeons who do actually recommend to their patients to do some red light therapy before and certainly after to help maintain results.
Yeah, thank you. Another question, any considerations on additional treatment recommendation for women during menopause or with hormonal deficiency? I guess this is addressing to the probably Emerald treatment.
Yeah, absolutely. And so I'm going to be a little bit of broken record, but I was actually sent something really useful from years ago that was published many years ago, which had a document which mentioned hundreds of medical conditions and all these possible frequencies that could be used. But I think ultimately sometimes there's a bit of a muchness, and actually, frankly, I just think if you just stick it on whatever frequency, you're going to get some benefits. Now, one of my staff who has a condition that essentially results in extremely painful periods every month without fail, debilitating pain. And I said to her one day, I said, look, go and just sit. And I know this isn't quite menopause, but I just want to make a point. And I said, go and sit under the Emerald. And she went under the Emerald laser. And actually, she's one of the slimmest people you meet, but she went under it. And she came back and her pain score went from what she said was 9+. And she's had babies, so she knows what labor pain's like. And so it was a true 9+. And she said, I'm down to a 4, if that. And that was 10-15 minutes under the green light laser. That's the power this has, reducing inflammation, reducing pain. And so actually, when we look at menopause, there's a whole bunch of different things happening, but mitochondrial function is also linked, guess what, in menopause as well. And you may have heard of the, I don't know who's asking this, but you may have heard of even things like NAD and how an increase in NAD can actually help with menopausal symptoms sometimes. Well, where is NAD involved? It's involved with the mitochondria and the electron transport chain. And so this is all linked. So if we use low-level laser and we're improving mitochondrial function, and we know that improving mitochondrial function can improve symptoms of perimenopause, menopause, then it makes sense. So actually the answer is absolutely yes. And just in our network, from staff and family, there are a number of ladies who are going through that menopausal, perimenopausal phase who have used low-level laser and have said that they feel better for it. Sometimes it's difficult to correlate because they might be doing other things at the same time, starting HRT or whatever. But even people who are saying I'm struggling have said, actually, I feel better. I'm not as my mood isn't as turbulent, or my flushes aren't as bad. It's very difficult to say that a given individual is definitely going to have improvements in this, and this when they do it. But what we do seem to see is a generally fairly consistent pattern that most people will report that in some way or other their symptom profile has improved.
Okay, and then we've got one final question. If you use this as a part of a lifestyle modification and program for diabetic patients, has there been any research on improved glycemic control due to enhanced mitochondrial function, and has there been any science of mitochondriogenesis?
That very last bit, I'm not sure what that is, but yes, in the answer to the other one. And I think I had let me just look. I think I had a slide on it, but I was skipping through those last slides. So yes, the answer is absolutely. If using just the 532 low level, the emerald, basically going under that, we would expect someone's glycemic index to improve, absolutely, because if you improve mitochondrial function, you are not only producing more energy, which is a good thing, because remember, cellular function depends on that energy. And if your cells are working better, more efficiently, then every process is going to improve. But better mitochondrial function improves your metabolism. And if you look at, pre-diabetic people, for example, where perhaps, if you were to do their HbA1c and say, oh, well, that's normal, or their blood glucose and say, well, that's normal. But, pre-diabetic state, increased central obesity, et cetera, you can actually demonstrate that there are, you can risk type those patients and say, well, you're more likely to get diabetes. Well, if you put someone like that through the emerald, you can already start improving their stats. And so therefore, I would say that you're essentially reducing their risk of going on to type 2 diabetes, developing diabetes. But just the fact that you're going to reduce fat, and there's emerging evidence that it even has an effect on visceral fat around organs, then by that mechanism, you're already going to improve their glycemic index, because we know that your ability to process sugar is better if you've got more lean fat and less bad fat. So the answer is yes, through mitochondrial efficiency or function, and directly by reducing circumferential fat, you're going to have a benefit on sugar control. So absolutely, the answer is yes. And I'll try before the end to find that slide which summarized all the sort of metabolic improvements, but there's plenty.
Great, I think that's all with the questions. Well, I would like to thank you, Dr. Dev Patel, for hosting this amazing, very insightful webinar, and for those that have attended the webinar. So don't forget, the recordings of this webinar will be sent out to all the attendees. If you have any further questions, we will be very happy to help with that. Please let us know, please contact us. Well, have a great evening, everyone, and thank you for tuning in.
Thank you. Thanks a lot, Jasmina. See you, everyone. Bye-bye.